I've wanted to become an MRT because I've always had an affinity to patient care as well as technology. When I was young, I always liked gadgets and things like that. I also like helping people. So for me, being an MRT was sort of the perfect blend of these two areas. We're providing a window into the body. We're providing a means to an end. We're assisting with the diagnosis of a patient. That definitely drives me as an MRT, and I think it's what drives most of my colleagues as well. At the end of the day, knowing that you've helped somebody and you've helped a physician make a diagnosis, that is the most important.
Sandra Reese Welsh. I'm a registered medical radiation technologist and the senior technologist here at St. Joseph's Healthcare in the angio interventional area. I impact patients' lives by trying to help them get through a difficult time in their life. I love to help people, and something that I really like is helping patients on their journey through their diagnostic procedures. I empathize with their anxieties and I try to help them get through their examinations and let them know that we really do care about them and that they do matter to us. And something I always try to remember is that each and every patient that comes through our doors is someone's valued family member, and those family members are entrusting us with their most prized possessions.
My name is Melissa. I'm a medical radiation technologist. I've worked at Hamilton General Hospital for 5 years. Being a trauma site, we x-ray these patients when they first come in, very badly hurt and damaged from whatever accident they might have been in, and then x-raying them, say, a week, 2 weeks later, and seeing them up and about and talking to you. And in totally different circumstances, but knowing you are a part of helping the doctors give them the best care that they needed to recover and to get to the position where they are today.
What inspires me are the children. They bring a smile to my face, they make me happy, and when they leave happy, that makes me happy, so it's contagious. I just want to do it again the next day. The advancement of technology has improved patient care because it's really come a long way. We're able to do non-invasive exams, we're able to answer clinical questions fairly quickly, and of course the patients are able to get through the test, which can be sometimes close to 45 minutes without sedation. We have the CinemaVision where they get to watch a movie or listen to music, so the technology has really come a long way. I just want to say a great big thank you. Without my colleagues, I would not be here today. And you know, they make me laugh, they inspire me, they stress me out, but I still love them. And everybody contributes, whether it's the nursing team, radiology, anesthesia, from management. Everybody really does their 130% every day. So good team.
Yeah, I love working here.
You just love it, I just love it, it's so great.
If I could speak specifically, if I was being an ambassador for the interventional area, then I would point out that in the diagnostic imaging department, we have an area where we not only provide an imaging, but we provide diagnosis and treatment options. On a day-to-day basis in interventional, we keep our patient focus as priority number one. Their needs, their comfort, that of their families is at the top of our mind at all times. Providing a warm blanket, it's the little things that go a far way in enhancing their experience.
What inspires me is the need to be able to help with my patients and make sure that they have access to the best care possible and the most diagnostic images we can give them.
We have to remember that patients are human entities. They're not just a number that's coming in through the door. That caring touch, that warm smile, taking the extra precautions to make sure that they're comfortable.
What inspires me is knowing that I'm providing the image that will lead to the better care and diagnosis of the patient. It's important because patient wait times have decreased dramatically since the days of film.
Being that I work at a children's hospital, we see some very sick children, but my inspiration is watching these kids and their families battle through these with such courage. The best is when they return to the department happy, healthy young adults, and they're taller than I am.
From an educational standpoint, I am privileged to provide teaching to the MRTs on a continual basis as the technology evolves. Again, always in the betterment of patient care.
What inspires me to get up in the morning is my alarm clock, because it rings very loudly. However, I also enjoy what I do. So I wake up and I come in knowing that Although I may not personally be healing the patient, I play a pretty significant role in their diagnosis and in their patient care. If I wake up in the morning knowing that I've helped someone, even if it is just giving them a warm blanket and keeping them warm for that day right after I've done their x-ray, then I've known I've made a positive impact on them. I am very excited with some of the new technologies coming out. One of the reasons why I got into it is because we're always expanding and always reaching into new world technologies. And I learned in school film, and coming into a digital world where I didn't have to develop film. Most of our older technologists, I shouldn't say older, I should use experienced, would like to always remind me that when they first started, they actually had to hand develop their film. While with me, I just had to expose and my image would come right away there. I'd like to give a shout out to the X team for extreme, not just x-ray, but the good works. Keep x-raying for life. Out.
Nice. You got your rocket going there. Finally. Finally.